In the last two episodes, we talked about who is actually feeling what and how emotions are taking shape inside the body. Today, we'll take our focus to the body itself. Welcome back to the Academia podcast. My name is Selina Skogan. I'm your host and the founder of Academia Science and Soul for Equestrians. Academia is standing for the connection between evidence-based training, ethics, and the art of riding, for a way of working with horses that is grounded in knowledge, empathy, and responsibility. As a trainer, I am working at the intersection of science and practice, and in this podcast, I dive into current research to help you truly understand your horse instead of simply trying to correct it. In this third part of our emotions series, we'll explore what many people can feel but few can explain, how emotions take form within the body and why the body keeps a score. A fascinating idea is, but not always, the complete story. We'll talk about what embodiment really means and what science knows about fascia and emotion, and why the body often speaks before we even notice it. Enjoy the new episode. When Bessel van der Kolk published The Body Keeps a Score in 2014, it hit like a thunderclap. He described how trauma isn't just a psychological event, it's also physiological, living in the nervous system and in the body. And maybe you're hearing already, I am in general a very big fan of that book. He argued that long-term stress changes brain regions such as the hippocampus and the amygdala, and that healing requires body awareness, movement, and regulation. That message was revolutionary. It gave legitimacy to the body's role in emotional health. But it's also not completely flawless science. And many neuroscientists, including McNally from the University of Harvard, have criticized van der Kolk for overstating hypotheses that remain unproven. Lately, there was a big article in the Washington Post, and they have put it very beautifully. They have, you should read it. We are linking it in our newsletter. They're saying that van der Kolk blends uncertain science with therapeutic enthusiasm, inspiring, but not evidence. So yes, the body responds to emotion, and it shows what we feel, but it doesn't store trauma like a hard drive. So if you think that the trauma that you have experienced or the stress that you experienced, you can find in your left elbow, then you're on the wrong track. Or as Steven Pinker is phrasing it, the brain is keeping the score and the body is showing it. And this is the moment where we need to discover what embodiment actually really is and what it means when we are saying the feeling is taking shape. The scientific term embodiment describes how mind, emotion, and body function are a single integrated system. Every emotion is physical. It's expressed through muscle tone, posture, breathing, heart rhythm, and movement. Maybe you have heard about an example that I like, that I think is very palpable, that I like using for explaining embodiment, and that is, I am jumping because I am happy, or I am happy because I am jumping. That is describing the thing well. So in the first example, I am jumping because I am happy. I am trying to express my happiness, the joy, the emotion that I'm feeling. And I feel energy in my body, and my body is trying to express this through the movement of jumping. The other way around, it works too. And I think that is something that is a key takeaway for today's podcast. I can also, through the jumping itself, through the movement itself, create the feeling of happiness and joy inside me. And understanding that was a breakthrough when we were looking as therapists, as body workers, as riders, as trainers, when we are looking at a horse, but here in this context, especially at a human. So we can use physical exercise, for example, to get out of depression. We can use we can use relaxation for helping healing trauma and so on and so on. The neuroscientist Antonio Damasio is putting it beautifully. The body is the stage on which emotions are played. Research is backing that up. A review by Critchley and Harrison in 2013 found that people with stronger interoceptive sensitivity, the ability to sense the inner body states like heartbeat, breath, tension, experience emotions more vividly and regulate them more effectively. Emotions just don't happen in the brain. They emerge from a constant feedback loop in between body and nervous system. And that is also our chance to regulate. In the last episode of this podcast, we have discussing that a little bit further. And this is holding true for horses as well. When a horse is freezing its breath, hardens its eyes, or is locking its neck, it is embodied emotion. It is not emotional or something, it is embodied emotion. And often we have difficulties to see that. This loop is working in both directions. The body is shaping the emotion. Emotions are influencing the body, and the body in turn is shaping emotion. That was my example with the joy and the jumping. Already in the last podcast, we have discussed a study by Keeling et al. From 2009, where researcher measure heart rate and heart rate variability in horses and their handlers. They discovered that the two rhythms are synchronizing during moments of touch and focused attention. If the two were having a bond with each other. The calmer and more grounded the human, the lower the horse's stress level. That's co-regulation, the two nervous systems literally tuning in on one another. And that, of course, is something that can happen also through bodywork sessions, craniosacral therapy, massage, osteopathy. They are all activating mechanoreceptors in the skin, muscles, in fascia, and they are sending afferent signals via the nervous system to the limbic system. And there the emotional states are processed. The result is parasympathetic activation, lower cortisol level, and the release of oxytocin. In other words, physiological calmness. That is at least the theory. And here is a little warning that I would like to, or a little reminder that I would like to pass on. When we are thinking back of the first episode of the emotion series that I'm producing here for you right now, then you might remember that I have discussed there some papers that were showing how difficult it sometimes is for human to recognize equine emotions and how often we are over-interpreting, especially when it is about positive emotions. So very often we are seeing horses that are actually anxious, and then the interpretation of the handler is that the horse is positively excited. And that, of course, is really wrong. So in this context, I'm often seeing that people are really happy every time the horse is yawning, or every time the horse is, blinking with the eyelid, and so on and so on. And while this might be physiological markers for regulating the nervous system, it can also be markers for avoidance. So it can also be a marker for discomfort. So please put it into perspective, and also put it into perspective of how would you like to be treated if you would be the patient. So if you would be on the receiving end, would you like to be tied in ties so you can't get out of the situation? Or would you like to have agency over your own body? I did a lot of further education, also for humans, because there's a lot of stuff that is only taught on humans. And I really appreciate, especially when I'm learning, I really appreciate the vocal feedback loop that I can get when I'm working with a human patient. They can tell me, I don't feel comfortable in this moment. They can tell me, please put your hand a little bit higher, a little bit lower. And my hands and me, we can observe and we can learn, and then try to transport that on a horse. I feel very, very privileged with that way of learning. And I feel that that this is an experience I wish for every osteopath, for example, to have. So also there, when I am in a group of equine osteopaths, there's quite a lot who never got a treatment themselves. So I really recommend you to catch up with that. It's a great experience, and you will learn a lot about what you like and what you don't like. Back to the red thread. It took a lot of forward education also on trauma and trauma patients and how to work with them, how to handle them. And one of the biggest reminders that I got there was that treatment should not be re-traumatizing. So the worst thing I can do as a therapist is put a patient in place and put them in the position of being nice. So if I'm putting them on a table, for example, like we are often doing that, and if I'm the patient myself, that's even the position I prefer. But that doesn't have to be true for everybody. So we don't want to put a patient in place and fix them there and say, please lie there, don't move, or please lie there, be a nice girl. And then at the same time, we are very dominant, standing next to them, bending over them, and they get the feeling of not getting out of the situation again. Not so beautiful. And in reverse, I feel we can create here a very empowering situation. We can have here a situation where we are giving the person agency to get back control, to gain back control over their own body by the simple question of, how would you like to work today? Yeah, very simple. How would you like to work today? Would you like to sit on a chair, on the floor? Would you like to lie? Would you like to stand? How would you like to work today? What do you feel your body needs today? I'm borrowing you my hands. And I'm transferring that on horses. So I don't like putting them into cross ties. I don't like putting them into a very confined space where they can't get out of the situation. And sometimes we need to work with a halter because we are in a situation where nothing else is working. For example, if we need to work in a riding arena and 3 other horses, can't let the horse run off, but I can put a long rope on it, put it over the horse's neck, and allow the horse to move around me. Just as a simple example. It doesn't always have to be complicated. The moment we are mindful and aware, it's starting to get pretty simple. And I see a lot of horses during treatment where, if we are putting signs of discomfort on there, like pain faces, or also 24 behaviors, a written pain ethogram, and so on, where we are seeing that the horse does not feel comfortable during the treatment, and it really would like to. It's really asking politely all the time to get out of here. And then we don't have this empowering experience about that I was speaking before, but we have an experience where, I don't want to talk about trauma, but where the horse is going more towards learned helplessness than towards empowerment. And that was actually not what we wanted to do, right? So that was not our intention. So the body is shaping emotion, and the emotion is shaping the body. And this loop is working in both directions. So it can happen that after a good and empowering treatment, we actually feel this empowerment inside ourselves. The horse is more happy, and we are taking a big step towards recovery, for example. We had a paper already in the last session that was from Keeling et al. From 2009. And their researcher measured heart rate and variability in horses and their handlers. They discovered that the 2 rhythms synchronize during moments of touch and focused attention. The calmer and more grounded the human, the lower the horse's stress level. That is co-regulation, where 2 nervous systems are literally tuning in one another. Of course, that can happen also during body work. But where it really should happen is not only through craniosacral therapy or massage or osteopathy, where we have this activation of mechanoreceptors in the skin, but it should also happen during daily handling, where we are seeing this tuning in and can give with that an afferent signal to the limbic system, where the emotional states are processed so that the horse can co-regulate and relax. So we are giving the horse our calm, also through the release of oxytocin. So little reminder, relaxation always helps, and a good bond in between human and horse always helps. Then let's have a little look at fascia and emotion and what we know so far. Because the phrase emotions are stored in the fascia sounds very poetic, but science paints a more nuanced picture by now. We know that fascia is a highly sensory tissue, rich in nerve endings that are responding to tension, vibration, and pressure. A paper from Schleip et al. From 2012, Robert Schleip here from the University of Hanover, showed that fascia isn't just passive wrapping, it's an active sensory organ that is communicating with the nervous system. So far, so good. That also means that chronic stress, however, is changing how this tissue behaves. Also, there is a paper out from a different group from 2015 that found evidence of sympathetic nerve fibers within fascia, meaning the tissue is directly influenced by stress responses. Under long tension, collagen fibers thicken, hydration is decreasing, and the fascia becomes less elastic. That means stress can quite literally shape the body. But if it is only storing emotions, I don't know. So what persists are neuromuscular patterns, protective postures the nervous system keeps until it feels safe to release them. And when an osteopath or craniosacral therapist is restoring mobility, new sensory input tells the brain the danger is gone. The nervous system is recalibrating and sometimes visible as yawning, trembling, sighing. Not because the emotion was massaged out, but because the body finally is relaxing out of the defense mode. So fascia doesn't store emotions, but it can reflect them. And here I would like to bring up another topic, because fascia is so much more, has so many more functions in the equine body than just storing stress or storing emotion. It would be so nice if just by releasing the fascia, we could take away all the pain that the horse has and all the compensatory postures that the horse has. Of course, stress is a key player. So of course, everything is getting better when we are dealing with stress. But from my experience as a trainer and getting more and more into functional anatomy and gait analysis, I can say that most often the stress is not only coming from the surrounding, but most often we also have pain issues. And that is the reason why the horse is looking like the horse is looking and why the fascia is so tensed. And does it then really, it's a question. Sometimes it can help to release these tensions and sometimes it can't. I've seen a lot of chronic sick horses where releasing tensions was doing more harm than good. And I saw a lot of chronic sick horses where it actually worked and was giving life quality, not because the disease was suddenly gone, but we had this empowering experience about that I was talking before. And not because everything was suddenly supple again, but the empowerment. So I think that we are often overestimating the healing effect of treatment and underestimating what positive emotions can do to a body and to a mind. So when we are thinking about body work as empowering, and that body work works because it's communicating directly with the autonomic nervous system, then we need to think also about C-fiber touch nerve endings. C-fiber touch are already in the German version of this podcast found out. We haven't talked about that before. I think I need to make a I need to make a podcast. I need to invite one or the other researcher here, and we need to discuss the C tactile nerve fibers, because they are found pretty recently, I think just a few years ago, and they are so super important and super. It's a powerful tool. It's a powerful tool to know about them and to activate them. But gentle rhythmic touch is activating C tactile nerve fibers that are sending calming signals through the nervous system to the brain. That is super interesting because we find them very close under the skin. And that is also, what we are experiencing sometimes as a therapist is exactly that. The softer the touch, the deeper it goes. And now we have a physiological explanation why it is like this. It's simply a different receptor group that is activated and that is responsible for calming the nervous system down, also by the social factor. There's a paper from 2015 from a research group that is will be linked in our newsletter, but that is very sadly impossible for me to pronounce. Uvnes, I don't know. I will link it in the newsletter. And that was published 2015 and demonstrates that tactile stimulation in animals increases oxytocin release, lowers heart rate, and reduces anxiety-related behaviors. And I think we can call this a super tool. And that is why a horse is often exhaling, chewing, or yawning after a session if you know it already, it was empowering. Otherwise, it's yawning and chewing because it's over. So that is maybe also not what we want to create. But let's go out. Let's take the best case possible. And then it is having this exhaling because of the regulation that has happened. It's physiologically rebalancing, basically, right? So body work in the very best sense can be applied neurophysiology. And then our hands can become instruments of regulation. In the last podcast, we have discussed another paper that I would like to bring up on this point here again. And that paper was showing very beautiful. That also here we can't just say scratch the wither and then the horse is experiencing regulation. It has to go a little deeper than that. You have to have a good relationship with the horse. Otherwise, nothing happens, or even the opposite thing happens. And I think that we all remember from ourselves, if there's a person that we really don't feel, drawn to or sympathetic with, then there will, this effect won't happen. Right? Then we will feel, I don't want you to touch me, but we won't rebalance or recalibrate. So that was a word that wasn't getting out of my mouth. So let's play that back into training. So where is the crossroad to training? When we are looking at this point of fascia and the body keeping the score or not keeping the score. Negative emotional states don't just arise from trauma. They can also be created in everyday training. When horses are pushed into postures that restrict natural movement or cause discomfort, the bodies reveal emotional strain. Surprise, surprise. So there's a large-scale study of over 350 horses from Le Simple and Hausberger from 2014, finding that animals displaying stiff necks, fixed facial expressions, or asymmetrical movement patterns were far more likely to show chronic stress and depressive postures also afterwards. Their physical form mirrored the emotional state. Interesting, isn't it? There was also a follow-up study from the Hausberger group in 2021 that showed caretakers and trainers often underestimate signs of distress by up to 7-fold. And I thought that was pretty shocking. So the researchers concluded that posture and facial expressions are essential welfare indicators and that chronic tension is often also a symptom of emotional imbalance, wherever this emotional imbalance is then coming from. Yeah. So is that only training related or think 5-domain model again. So when we look at the horse's body, we just don't see conformation, and we see a state of being, and we don't see. So I'm really getting irritated when a trainer is coming into the ring and he's looking at we are looking at conformation, and then we say, yeah, that was that we need to change, instead of getting curious why the horse is in that state of being. When we're continuing that line of thought, then we are all thinking, of course, immediately towards Rollkur, and all the other flexed postures that we can force horses into, overflexing their necks, for example, which must be extremely discomfortable and painful for the horse, because it's also going completely against sensomotoric and proprioceptive rules, basically, in the body. But also, when we see horses with a high neck, so when we see horses that are getting fixed in an absolute, now I'm lacking the English word. When the frame is getting too narrow, basically. So when we are taking horses very high or very low, or also when we are doing this long and low thingy, and we are forcing the horses to keep their nose on the ground, I think all of that is creating not only very uncomfortable postures, but it's also taking away agency of the horse to see the environment, but also to see the ground, to see the environment, and to have simply agency over their own body. Yeah, let's keep that in mind for the next training, and maybe once in a while also ask the horse, where would you like to carry your head? What do you think is a comfortable posture? And instead of considering about how can we do that, take that away, we are asking the horse what it really feels. So what did we learn today? Or what did we learn today? First, we had a look at what emotions are, and that emotions are embodied processes. They emerge through interaction between brain, body, and environment. We had a look at a book that I really love for creating more awareness and bringing more attention to this truth, but is a little bit oversimplified in one or the other perspective. So don't take it as a set truth. Fascia is reacting to stress, but it doesn't store emotions. It's reflecting patterns of tension, and these tensions can be, from an emotional source, but not only. And often we see a physiological pattern underneath. Bodywork can support regulations through physiology. Doesn't have to. We think about that we want it to be an empowering experience. And training can shape emotions for the better or worse, depending on whether it works with or against the body. So, what's our takeaway? Next time you place your hands on a horse, whether during massage, craniosacral sessions, or simply grooming, remember you're speaking to a nervous system and not just touching a muscle. And maybe take your own ego a little bit back and ask the horse what it really needs, and be an interested observer. Ask yourself, what is this body telling me, and what does it need to find regulation again? Is it a pain pattern? Is it a stress pattern? Does it need more emotional bonding? What's going on here? Because true healing doesn't always start in the mind. It often begins under your hands. And that is especially true for training, when we are forcing head and neck into, often unphysiological positions. Maybe the body doesn't keep the score, but it is telling the story and big parts of the story. So, in this sense, I wish you a very nice weekend. We are very happy for your feedback, and I'm looking forward to meeting you again next week.